What is angioplasty? How it is performed by doctors step-by-step practically in video angioplasty, also known as percutaneous coronary intervention, PCI, is a minimally invasive procedure to open narrowed or blocked blood vessels. The detailed steps involve preparation, catheter insertion, balloon inflation, and often stent placement. Before the procedure medical review, your healthcare team will review your medical history, any medications you take, including blood thinners, and allergies, especially to the contrast dye. Fasting. You will be instructed not to eat or drink anything for several hours before the procedure. Preparation. You will change into a hospital gown, and an intravenous IV line will be inserted into your arm to administer fluids and medications. Electrodes will be placed on your chest to monitor your heartbeat. Sedation. You will receive a mild sedative through the IV to help you relax, though you will likely remain awake during the angioplasty. 1. Access point is numbed. A healthcare provider will inject a local anesthetic into the area where the catheter will be inserted, typically in the groin or wrist. You may feel a brief sting or pressure but should not feel pain during the procedure. 2. Sheath is inserted. A small incision is made to access the artery. A hollow plastic tube called a sheath is inserted into the artery, which acts as a guide for the catheters and wires. 3. Catheter is guided to the heart. Using X-ray guidance, fluoroscopy, a catheter is threaded through the sheath and into the artery, guided to the site of the blockage. This is painless as arteries have no nerves. 4. Dye is injected. Once the catheter is in place, a contrast dye is injected through it. This makes the blood vessels clearly visible on the X-ray monitor, allowing the doctor to pinpoint the location and severity of the blockage. You may feel a warm or flushing sensation as the dye moves through your body. 5. Guide wire is advanced. A fine guide wire is carefully passed through the catheter and maneuvered across the blocked or narrowed area. 6. Balloon is inflated. A new catheter with a tiny, uninflated balloon on its tip is advanced over the guide wire to the blockage. The balloon is then inflated for a short time, pressing the plaque against the artery walls and widening the blood vessel. You may feel slight chest discomfort during inflation, but it should resolve when the balloon is deflated. 7. Stent is placed, if needed. A stent, a small expandable metal mesh tube, is usually inserted along with the balloon catheter to hold the artery open permanently. When the balloon inflates, the stent expands and locks into place. The balloon is then deflated and removed, leaving the stent behind to maintain blood flow. Most modern stents are drug-eluting, releasing medication over time to prevent the artery from re-narrowing. 8. Catheters are removed. After confirming sufficient blood flow with another angiogram, the catheters and guide wire are removed from the body. 9. Puncture site is closed. The insertion site is closed either by applying manual pressure or by using a special closure device.